Gabriel McSharry, nutritionist and medical herbalist. A safe and effective approach to your health condition. Call the clinic on 071 9142 940.
083 3500 530. Text call is at 081 500. This listener saying their hair is thinning. What can they do about it? They always had long, thick hair. Now it's going fine. Is that the season that we're in, or is it?
No, I wouldn't think it's seasonal. It's actually something that's on the increase, though. Specifically in females. I'm assuming this caller is female, just with long, thick black hair or whatever. It may not be, but if it is, are you around 50 or close to menopause, perimenopause, or I'd also maybe check thyroid function. And if it is any of them two, then well, in that case I'd use certain herbal medicines appropriate to that area for the treatment of it, because it'd be a hormonal cause. But it can also, I mean, it's important to know with here, nutrition is important here, is very physiologically active. And there's a couple of stats here that always shock me when I drag them up, but you spend a lot of calories and protein growing your hair, and the average person puts on 12 feet of hair per day.
12 feet per day?
Yeah, it's I couldn't believe it when I read it first a few years ago, but it's when you added up the tiny little increments of growth throughout the whole head. So protein is important. It's important in general for the body. It's the building blocks of the body, really. But so a body that's challenged with a very stressful event or deficiency, the body prioritizes energy to nourish the organs as opposed to hair. So there can be a nutritional aspect to it. Male pattern baldness is on the increase, and women can get it also. In fact, a lot of the we'll say rapid thinning of hair women get could be generally male pattern baldness. So studies have linked this with insulin resistance. So in men, but it also apply to women.
Women as well. Okay.
So that'd be something to take into account on a nutritional level, and herbal medicines as well, because there's really good herbs to increase insulin sensitivity, and obviously nutrition guidelines can reduce the amount of insulin you secrete in the body and so on. But in general, for hair growth, there's a number of herbs that I use that have been used traditionally, most of them, but saw palmetto berry extract, that'd be my number one. There's good research on that. Ginkgo biloba, equisedum or horsetail. So generally them along with other ones, but they're the main ones for hair growth.
Okay. This listener says they got a cyst removed from their breast, was back for a checkup. The consultant happy with the operation. He told me it will take time, but it's very painful yet. Does Gabriel know of anything that would help?
Yeah, well, in this case, there's certain oil infusions of herbs. So it's the herb soaked in oil for a number of weeks or a month, and then they take out the herb, and you're just left with the oil. But the oil takes on some of the active constituents and medicines of the herb. And in this case, where there's scarring post-surgery, and pain and tenderness and so on, there's a number of herbs, and they have antimicrobial, antibacterial actions, but also the increased meteosis, so the healing of the area, so where there's been a trauma or a surgery. So there are there's about 4 of them that I use. I usually mix them together, but comfrey, definitely the number one here. It will speed up the healing of the and reduce scarring area as well. Mm-hmm. Yeah. So St. John's wort, which internally is used for the nervous system, insomnia, menopause, depression, it as an oil infusion topically will reduce scarring and increase the amount of healing, decrease the time it takes for a wound to heal, and calendula oil. So them 3 definitely very good applied topically.
Okay, this listener suffers from UTIs, I presume that's urinary tract infection, have had several antibiotic scans, cystoscopy, but still feel like I'm getting them. I drink up to 3.5 litres of water daily, eat a balanced diet, and they say they get, well, I'll not repeat what they're saying, but basically they're fed up with getting these reoccurring UTIs.
All right, yeah. Again, it's good that you're taking on a lot of water. That's important to kind of flush the kidneys out. But I'd also add a few things. Cranberry juice, I'd get 100% concentrated cranberry juice, and you can drink that in small amounts over the day, like say a shot of it, so 40 millilitres, maybe dilute it down with water. Your cranberry juice has a constituent in it. When metabolized through the liver, goes to the kidneys, and it takes out E. coli, which is the prominent bacteria that causes UTIs. Now, I'd also there's also urinary tract herbs that are really good, demulcents, so they'll reduce the pain that one gets with urinary tract infections, and also, like the cranberry, will knock out bacteria or microorganisms in the kidneys, bladder, and so on. However, I'd also immune system is important too, but what's shown in studies, which I find very interesting, is because a lot of people ask why are they getting the recurrent ones, and that microorganisms can migrate from the colon, from the gut, to the bladder and the kidneys. So it's of vital importance to have the gut in good health, and that's if there's any bloating, wind, flatulence, diarrhea, constipation, abdominal pain. So the UTIs, generally the pain is to the back, but abdominal pain, then also treat that. So probiotics, also good diet, herbs, cut sugars out completely until the urinary tract infections stop.
Diet has an awful lot to do with an awful lot of conditions, doesn't it? A lot of conditions.
Because, as I say before, and anyone with recurrent infections, their immune system is suppressed. So what's suppressing it? Now, it can be suppressed by many things. Like athletes have suppressed immune systems from overtraining, So, well, let's bring that to normal people. If you're stressed with work and you're rushing your foods, whatever, so there's them lack of sleep. Also, high sugar diets have been shown to nearly halve your immune function, so halve your white blood cells. So this again is a very common thing to see now in Ireland, is that we're taking on sugar from nearly every source in all meals and in snacks. To be draconian now that you're getting recurrent infections, but in time you can add some sugar back to the diet, but for a period of time, because you're getting them recurrent, I cut it out altogether. All processed sugars,
All right, this listener waiting to have their tonsils out. Is there anything that they can gargle their throat with to ease the pain when they flare up, I presume, while they're waiting to have them taken out?
Yeah, I mean, on a dietary standpoint, I'd just while you're waiting for surgery, maybe to consume fluids like vegetable juices, lukewarm herbal teas and water, and eat lightly, because obviously eating big meals and that is going to be stressful in that area, but also, I mean, if you can at all, try not to talk as much, and give the vocal cords and that area a rest. Avoid fizzy drinks and carbonated water, like fizzy water. Anything with the fizz in it also irritates the area. And also any toxic inhaled substances like air fresheners, scented household agents, and even scented candles. Now, to gargle, my number one as a gargle for any throat, tonsillitis, throat infections and so on is golden seal. So it's a herb called, its botanical name, Hydrastis canadensis. So 5 drops in a small amount of water, and you can gargle with that. It's our greatest natural antibiotic, and it's really good. Other, I guess, home remedy things: a bit of lemon juice with a bit of raw honey, manuka maybe, or a good raw honey in a bit of warm water, mix it and sip it, and you can gargle with it if you want, but that'll be good as well.
What about the lukewarm water and salt in it?
Yeah, salt water definitely for sore throats in general. For recurrent tonsillitis, it may ease things, but I don't think it'll go.
No.
Well, it could do. If it does, probably stop. If it, sometimes it can flare it up worse. But
okay. This listener has protein and blood in their urine. What would be the cause of that? I presume that they have gone to their GP and had a test done on that. And
maybe they might have had a home dipstick. I mean, you can buy them in the chemist now where you can test it, but it's more likely they've been to a GP and he's done that or she's done that. And it could be a few things. Most likely damage to the kidneys. So the kidneys, very, very complex organ on a mechanical level, and it has a filter, and it filters things out of the urine, and it keeps things in the body and lets things through. Doesn't let proteins through. They're too big, the molecules. So if they are going through, it's likely that there's damage to that filter. And so why you gotta, I guess, look for is there also blood present in the urine or white blood cells? And if so, there's a possible infection.
Mm-hmm. Protein and blood in the urine, they're saying.
Right, yeah, possible infection. And again, back to the recurrent UTIs, very similar from my standpoint. How I treat that is with urinary tract tonics, antimicrobials, also in the diet. Make sure you're drinking cranberry juice. If it's out of the blue and you're not even too sure what's causing it, and you're generally healthy otherwise, there could be some autoimmune condition there as well, you know. And again, it's something I think there's certain blood markers that you can check for that. But vitamin D is of vital importance with all these autoimmune things and immune conditions in general. And I mean, in a sense, it's good that you can keep an eye on this. So generally, what I do with people with proteinuria, give them urinary tract herbs and antimicrobials, and then in a month later, you can check the urine again. Simple little dipsticks to check for 9 things: protein, blood, white blood cells, pH, and so on, and you can track it that way. Okay. And if there's no improvement over time, then I would investigate further.
Okay. Now, this is the listener that we mentioned who had the cyst removed from her breast. She just wondered, she just needs clarified what you recommended. Does she rub that onto the area? Oh,
sorry, yeah, apply to the area, and also around the area, around the breast, because it soaks in by the skin via osmosis, and but it'll aid the healing. So calendula oil, hypericum oil, and comfrey oil. Comfrey is the main one.
Okay, and finally, I have a wee girl of 17, not sleeping at night, very tired but still can't sleep. Found her this morning at 4 a.m. drinking a glass of milk. What's wrong? No exams, family or friend problems. Any suggestions?
A girl of 17. 17. Yeah, I mean, I'd assess for all type of things that can cause insomnia and stuff. I mean, was she drinking the milk? Did she know she was up drinking the milk? Or, some people can...
Are you saying she could be sleepwalking or something?
Yeah, it was just the way the text is worded, I suppose. I found her, kind of drinking milk as if she didn't know she was there herself. But anyway, in general, insomnia is a massive area, and it's important. This is where the perfect, I suppose, triad approach I take. So diet, lifestyle and herbal medicines. But lifestyle is very important here. So if someone is having trouble sleeping, and there's loads of people listening today who do, exercise is of vital importance. If you exercise during that day, you'll sleep better. But also the circadian rhythm, so get as much daylight or natural light as possible during the day, and then at night sleep in complete darkness, and that balances hormones, melatonin, serotonin, that improve sleep function, and they're very important. So they're two lifestyle things, and a number of things in your bedroom too. Get all lights out of there and get off the mobile phones at night, TVs, laptops, get them all out of the bedroom and have it just as a sleeping quarters, we'll say. And then there's herbal medicines: valerian, verbena, passion flower, St. John's wort. All these are really good nervous system tonics that are good and they're mild as well, that you can take in low dose, that will improve sleep.
Okay. Gabriel McSharry, medical herbalist and nutritionist, thanks a million for joining us. And of course, you're back with us in 2 weeks' time. We have a lot of questions. We'll certainly keep them on our list, and we'll get them when you're back with us. And you're back in 2 weeks' time.
That's right. Thanks, Margaret.
Okay, rejoin us.
Gabriel McSharry, nutritionist and medical herbalist. A safe and effective approach to your health condition. Call the clinic on 071 9142 940.